Blood lactate prediction. Lactate description. A lactate is a value that is measured from the blood. This can be a point-of-care test. The description of a lactate is as follows. Under normal circumstances, tissues can be considered as lactate producers or metabolizers. The arterial plasma concentration of lactate reflects the balance between production and its consumption or clearance. The healthcare problem. In the development of regionalized health systems, it is now more important than ever to identify a patient's needs and assure proper delivery to the appropriate facility. At times, the patient's injuries or illnesses may not be readily identifiable, nor the severity of them. Utilizing a blood lactate level can be a useful tool in identifying patients with a higher acuity than what they are presenting with at the time. This can help assure the proper treatment is initiated in a timely manner, affecting patient outcomes. Supporting data. Obtaining the lactate can be a useful predictor. In the research article Ramos 2017, a serum lactate was obtained on patients with a clinical suspicion of infection. It was found that a single venous lactate provided substantial information to predict a probable patient complication within 7 days. This information can be used to predict the patient's treatment plan and potential outcomes using a low-cost, minimally invasive test. Topic importance. This project was chosen due to the increasing need for more accurate and timely resuscitation of patients that are experiencing signs of sepsis, a complication of cancer, or are suffering from a traumatic injury. Early intervention leads to more successful outcomes and fewer resources needed for less time. If the patient can be identified closer to the onset and intervention is made, then the patient will use less resources and have less time within the hospital system. This will free up resources for the health system. Purpose. The purpose of this project is to expand the concept of using lactate levels to predict high acuity patients in the pre-hospital setting. This method has been shown to improve recognition and intervention in the emergency department and shows promise to be used in the pre-hospital setting. The PICO for this evidence-based practice is as follows. P. The patient population is identified as any individual that is seeking treatment with a diagnosis of sepsis, cancer, or traumatic injury. I. The intervention is the evaluation of the serum blood lactate level of the patient at time of treatment. C. The comparison would be the initial treatment being done on these patients. Does it differ when a serum blood lactate is used versus another assessment tool? O. The outcome that would be beneficial with supporting evidence would be to utilize a lactate meter and obtain serum blood lactate reading on all potential septic and trauma patients as a predictor for further treatment. Article research. In developing a plan to accumulate 5 studies of similar topics to support the use of lactate levels, a search engine through the school library was utilized. The search strategy utilized was simple. The first keyword used was lactate. Secondly, words like aeromedical and pre-hospital were used to try and find data to support a pre-hospital protocol for lactate evaluation. There were not many research articles that were contained in the pre-hospital setting, and the ones that were did not have sufficient data to support change, primarily due to the level of evaluation. There were no research articles found for aeromedical care and the use of lactate levels. There was a sufficient amount of research data identifying the use of lactate levels within the emergency department for patients with the same presenting diagnosis. This can be expanded upon with further research and potentially used in the pre-hospital setting in the future. This literature search was more difficult than others due to not being able to find specifically aeromedical lactate research information. The pre-hospital studies revealed that there needs to be more research to conclude the effectiveness of lactate levels in the pre-hospital setting. Literature synthesis. Emergency department settings. The implication of lactate levels being a predictor for treatment is not a new concept, although it is being used with more confidence. In Odorf 2016, Mayer 2017, and Gomez-Ramos 2017, all three of these studies are attempting to identify the utility of lactate monitoring in a medical patient that presents with potential of sepsis or cancer. The benefits of lactate screening and treatment are described in each. Gomez-Ramos 2017 and Mayer 2017 identify a more significant correlation between outcomes at 7 days and an initial high serum lactate level. Odorf 2016 concluded that serum lactate does correlate with outcomes that are adverse during their hospital stay. This study did not specify a timeline for this like the other two studies did. Literature synthesis for pre-hospital settings. In the pre-hospital setting, the research indicates that there is a need for further development of supporting data to utilize serum lactate levels to predict further medical intervention. When relating to trauma patients, St. John 2018 supports the use of serum lactate levels to predict traumatic injuries with normotensive patients. This supports the use of expanding lactate screening into the pre-hospital setting, although the research identifies that there is a need for further development and validation. When discussing the use of lactate levels on pre-hospital septic patients, Boland 2016 concluded that there is not a statistically significant improvement in identifying septic patients with a serum lactate. Additionally, the lactate level being collected pre-hospital did not augment the care of the patient once they arrived in the emergency department. The study did identify that it was small in volume and there would be benefit to having a larger study model to gather more data. Review of the synthesis process. Compare and contrast and challenges. The process that was used for the synthesis of these studies was to compare and contrast the findings related to obtaining a lactate level on patients. There has been sufficient data to support emergency department processing of lactate levels, but inconsistent data to support pre-hospital process of lactate levels. The articles were reviewed for consistencies and themes to support the use of lactate levels. Although the emergency department studies were focused on 3 different disease processes, the results were all similar. I did not run into challenges when compiling data. There were several studies that were literature review and did not meet the focus of this study review. Practice management. The recommendation to come from this literature review would be to implement the use of serum lactate monitors on patients that present pre-hospital with suspicion of disease process or traumatic event that presents with potential for inadequate tissue perfusion, even if the patient is hemodynamically stable at the time. The study data supports in its use within the emergency department and it also supports its use for pre-hospital trauma patient selection. The data did not show a statistically significant difference with lactate use on septic patients pre-hospitally. In transparency, Boland's 2016 concluded that there needed to be more research to validate these study findings. Currently, the Flight Service does not support the use of lactate meters to evaluate potential patients. This has not been supported by study data outside of the hospital, even though it has been supported for use within emergency departments. The treatment of a patient being cared for by a flight team is very similar to the treatment received within an emergency department. With a deduction, it would be a benefit to further study the effects of pre-hospital lactate evaluation and treatment. Upon further expansion and research of pre-hospital treatments involving lactate levels, there may come more supporting data for its use. Potential issues. Cost and education are key components in any procedure implementation. The cost of a lactate machine is a few $100s. The education that will be needed is minimal and can be done with competencies on a regular basis. Protocols would have to be written to direct the care once the data was received. The ability to implement this process would have little impact on the flight service and is easily attainable. The potential benefit to the patient could be extensive. In summary, the collection of serum lactate level on a patient that has the potential to become a high acuity can be beneficial. The research results have shown within an emergency department that the lactate level is a predictor for patient outcomes at 7 days from initial treatment. This can be a benefit to the patient for treatment and to the facility for planning in relation to length of stay. Even though there is limited data to support the use of lactate meters in the pre-hospital setting, it does look as if once there is more research, there will be a correlation similar to the emergency department findings. The flight services need to push for the most advanced data collection and rapid identification and treatment of patients that are or have a potential to become a high acuity patient. Pre-hospital serum lactate levels can be a potential future standard of care if research continues to move forward.